Cystinuria is a genetic disease characterized by high levels of cystine in the urine. Unsurprisingly, this can then lead to the formation of cystine stones in the kidney. In this video, I'll give you a quick visual mnemonic to help you organize all the information about cystinuria. Let's head on over to the Sistine Chapel where this scene takes place. Yeah, we're tourists inside the Sistine Chapel. The Sistine Chapel here should make you think of cystinuria, as well as the accumulation of the amino acid cysteine. You know, cysteine for, well, cysteine. Anyway, we were trying to get into this special area of the chapel, but access is restricted. Apparently, the Pope is writing some sort of secret missive or something like that. And now, we have to wait in the main area, behind the fence here. By the way, our restricted access in the Sistine Chapel helps me remember the cause of cystinuria, a defect in cystine transport. Specifically, cystinuria is caused by a hereditary defect in an amino acid transporter located at the renal proximal tubule. This transporter usually reabsorbs cystine from the urine, and since the transporter is broken, we get increased urinary cystine. Fittingly, the high ceiling of the Sistine Chapel helps me remember that urine cystine levels are high, and this fence blocking movement into the front area helps me remember that cystinuria is caused by defective cystine reabsorption. Let's see what else is happening in the outer area. See those ornamental chandeliers? Yeah, they really look like ornaments, right? These ornaments are a recurring symbol for ornithine. Ornament for ornithine. Get it? Like cystine, ornithine reabsorption from the urine is impaired by defects in the same amino acid transporter. Just remember these ornaments inside the Sistine Chapel and you'll have this under wraps. Actually, there's two other amino acids that are usually reabsorbed by the same transporter. For the first, take a look at this lace here that decorates the fence. By the way, lace is a recurring symbol for lysine, or should I say, lysine. And you guessed it, lysine reabsorption from the urine is also impaired in cystinuria. Finally, move your gaze on over to us. Yeah, we're tourists from Argentina. By the way, this Argentine flag helps me remember arginine, the last amino acid affected in cystinuria. Argentine for arginine, get it? Since Pope Francis actually happens to be Argentinian, we just thought we'd display a little Argentine pride. In summary, cystinuria is caused by defects in amino acid reabsorption from the urine. Specifically, 4 amino acids are affected: cystine, ornithine, lysine, and arginine. These 4 amino acids are elevated in the urine and are commonly memorized using the mnemonic COLA. That mnemonic's not as good as mine though, but I thought I'd mention it here just in case it helps. So what happens when these 4 amino acids are left in the urine? For one, excess cystine in the urine can precipitate into cystine stones. What we're really talking about though are cystine stones, not cystine. Well, cystine is actually pronounced cystine, but I'm going to keep referring to it as cystine for clarity. Cystine is formed when 2 cystine amino acids join together via a disulfide bond. The chemistry isn't important here. What's more important to remember is that patients with cystinuria typically present with kidney stones. These cystine stones appear hexagonal under the microscope, a fact you can remember by picturing this guard's hexagonal stop sign here. Yeah, he's the guy in charge of blocking this area off. Didn't you know that stop signs are hexagonal in the Vatican? Anyway, the hexagonal shape under the microscope is high yield for differentiating cystinuria from other causes of kidney stones, and you can remember this as our security guard's hexagonal sign here. So, some of you are asking why we tourists and the guard are so frazzled. Well, it's probably because there's a big cyborg flying in. I bet you didn't see that one coming. I think he's trying to steal that written missive over there. By the way, this cyborg is a recurring symbol for cyanide, since cyborg sounds a lot like cyanide. And did you notice his nitro boosters leaving a trail of blue flame? Yep, this cyborg has been outfitted with nitro boosters, which is a recurring symbol for nitroprusside. Taken together, this cyborg with nitro boosters should help you remember the cyanide nitroprusside test, which is used to confirm a diagnosis of cystinuria. The cyanide nitroprusside test is used to rapidly determine cystine concentrations in the urine. Cyanide converts cystine to cystine, which then binds to nitroprusside to induce a purple color change. You don't need to know this level of detail, by the way. Just remember that you need to use the cyanide nitroprusside test to confirm a diagnosis. Now let's change gears and talk about treatment for cystinuria. There's no way to really fix the defective amino acid transporter, so most of these treatments just focus on preventing kidney stones. First, notice this pencil that was used to write the secret missive. This pencil should remind you of the drug penicillamine. Get it? Pencil for penicillamine? Penicillamine is a chelator, meaning that it binds to cystine in the urine and converts it to a more water-soluble form. This increase in solubility prevents the formation of cystine stones, thereby treating the symptoms of cystinuria. Next, check out how our Pope was going for a bit of citrus water after writing his missive. This citrus should remind you of citrate, which is used to alkalinize the urine, making cystine more soluble. Specifically, potassium citrate is commonly used. Moreover, this citrate water is a bit of a loaded symbol, since the water also helps me remember that ample hydration can also be used as a treatment. Hydration dilutes the urine, preventing the precipitation of cystine that occurs when the urine is more concentrated. This is a pretty obvious treatment, so I'm just going to move on. Now, I didn't mention it earlier, but this back area is actually a no-shoe zone. Gotta keep things extra clean in here. Check out the Pope's shoes there, with special cedar soles. Wait a minute, cedar soles? Besides keeping shoes extra fresh, these cedar soles also help me remember acetazolamide, another drug that works to alkalinize the urine. Get it? Cedar soles for acetazolamide? Acetazolamide works by inhibiting carbonic anhydrase, which increases bicarbonate concentrations in the urine. The subsequent alkalinization of urine increases the solubility of cystine, therefore reducing the number of kidney stones. Lastly, let's talk about the cart that our water was served on. The Vatican's got some pretty cool catering. Since small automobiles, like carts, are our symbol for autosomal recessive inheritance, this cart should help you remember that the inheritance of Cystinuria is autosomal recessive. This is actually really hard to get tested on though, so I'd only remember this if you're going for that 270 plus. And aren't we all, David? Aren't we all? Alright, so now that you know that the Pope gets his citrus water catered on a fancy cart, I'm sure you'll be ready for any question on Cystinuria. All jokes aside, let's quickly recap what you have to remember. Cystinuria is an autosomal recessive disorder caused by impaired renal reabsorption of several amino acids. Specifically, the reabsorption of cysteine, ornithine, lysine, and arginine are impaired, which leads to high levels of these amino acids in the urine. The high levels of cysteine can cause the formation of cystine kidney stones, which are hexagonal under the microscope. To actually diagnose the disease, use the cyanide nitroprusside test to quickly determine cystine concentrations in the urine. Treatment is centered around preventing the formation of kidney stones, so alkalinizing agents like potassium citrate and acetazolamide are helpful, as are chelators like penicillamine. Like all other kidney stones, treatment also involves ample hydration. And that's it for Cystinuria. PSA, you should go grab a drink of water. Wouldn't want you to be getting kidney stones while watching Pixarize videos. Or am I thinking of DVDs? See you in the next one.